All right. Which of the following diagnostic tests should be performed next to determine the underlying cause? Okay, so what's causing this recurrent infection? Do we want to do an ultrasound, cystoscopy, MRI of the abdomen, IV pyelogram, or CT of the abdomen and pelvis? So let's figure out what this guy has first. 60-year-old man has type 2. He has fever, chills, left-sided flank pain for the past 5 days. He has a known history of recurrent UTIs. So he's febrile, tachycardic, a little bit hypertensive, and then CVA tenderness, elevated white blood cell count, urinalysis, pyuria, bacteria. So this guy pretty clearly has pyelonephritis. But with the history of recurrent UTI, So I think the best answer in this case, you want to evaluate number one, like when this guy has recurrent UTIs, like what is there any like renal abnormalities, right, that are causing this? Is there some sort of obstruction? Is there a reflux? So I'll go with the renal ultrasound. I forget exactly what IV pyelogram is. I'm sure it's like looking at the kidney with contrast.
Hmm.
For, I forget in like what instances, if ever, you would use that, but I think I'll go with the renal ultrasonography.
Yeah. So 100% here. So, what is your diagnosis here? If you give me one diagnosis.
Yeah, pyelonephritis.
Yeah, pyelonephritis, right, is going to be your best, right? And so, yeah, you just want to evaluate structurally, is there any, like you said, any kind of obstruction? Is there reflux? Is there a cyst? Is there a mass, right? Any one of these things can cause or increase your risk, right? Stones, even, right? And so, yeah, best thing to kind of evaluate is kind of your renal ultrasound here. But let's look at here. So, IV pyelogram, older imaging modality that involves injection of contrast material to visualize the urinary tract, is largely being replaced by renal ultrasound and CT due to increased sensitivity and specificity, as well as reduced risk of contrast-induced nephropathy, which makes sense. All
Okay.
right.
They used to do that, but not anymore. So
Yeah.
I guess if a question has IV pyelogram, don't choose it because it's outdated.
Yep, exactly. And renal ultrasound, if you think about it, it's like the modality is good that you can see in life, real time. And also on top of that, right, you don't have any kind of radiation, no IV, and so very minimally invasive imaging, right? So